Hey, this is Jeremy, and today we're going to be talking about public health. Now, public health is defined as the practice of preventing disease and injury, and promoting good health in a community or within a group of people. Now, in 2014, out of the over 30 million injuries that were reported and documented, over 93% of them were actually unintentional. So, those are things that, could have been preventable, such as real bad car wrecks that, could have used guardrails, or injuries that could have been worse without the use of helmets from motorcycle crashes, bicycle crashes, and things like that. Now, the way that these injuries are looked at is through things called risk factors. So, if you smoke, you're at increased risk for stroke. If you ride your bike without a helmet, you're at increased risk of head injury should you actually get into a crash. And that there's all these risk factors that they look at to kind of help gauge. That's where all these statistics come from that we use in our documentation. Now, when it comes to disease or injury of a child, they're much more susceptible to things than we are as adults. So, for example, a child, if they get involved in a bicycle wreck, their body cannot absorb as much energy, which is going to lead to an increased chance of injury for that child. So, for example, if as an adult you're riding a bike and you get hit by a vehicle, traveling 15, 20 miles an hour, you may be able to walk away from that. You're probably going to be injured, but in a child, that 15, 20 mile an injury crash that can potentially kill the child or very seriously injure, because their body can't absorb as much energy. Their airways are different. Their heads are proportionally larger, and they have less proportional blood volume, but they do compensate for a longer time than adults do. So, the way that researchers look at this is that they look at this as years of potential life lost. Is how they look at all this data to figure out, whenever somebody actually passes and dies from an injury, how many years of productive life were lost. Now, they gauge years of that somebody lives a productive life until approximately the age of 65, and then at 65, they're not losing any of those years of potential life lost anymore. So, for example, if you have somebody who's 22 and they die in a car accident or a bicycle crash or a fall or anything like that, then whenever they're pulling this data, they have 43 years of potential life lost. Now, if you have somebody that is 64 and they die in a fall, MVC, bicycle crash, same thing that 22-year-old would have. There was only 1 year of potential life lost as far as productive years to society. Now, that is kind of that's a way that they look at the data to kind of gauge the damage as a society we'll have. Now, we also have teachable moments that we deal with in public health. So if you have somebody that they were in a bicycle crash and they made it out okay, and they were wearing a helmet, the helmet's cracked, or a motorcycle crash, and they're okay, then that's the point where you can say, hey, if you hadn't been wearing your helmet, then this could have been a whole lot worse, could have been a different story. Same thing can be said of a car crash. If you have somebody that was in a car crash that made it out okay, and they were wearing their seatbelt, if you reinforce the fact that, hey, I've seen people get killed or seriously injured on a whole lot less car crashes than what you just went through. So consider yourself lucky, and good job wearing your seatbelt. And that kind of positive reinforcement for something that they did, hopefully that's going to make them an advocate for wearing their seatbelt or wearing helmets. And they're going to kind of help you by having that teachable moment prevent further injury from happening. Now, this can also be said of somebody who goes into a diabetic emergency after missing a meal, and it's like, hey, you can't eat, or you can't not eat after taking your insulin, because if you do that, then your blood sugar is going to drop, and you're gonna end up in a really bad way. Now, if you do this while you're driving, or if you do this while you're at work, or any of those other activities, this could have been a whole lot worse than it was. After you get them back, of course, and you make sure everything's okay. Now, when it comes to prevention, they have something that's called the 4 E's of prevention. It's called education, enforcement, engineering/environment, and then economic incentives. So the education, that's what a lot of schools will do for there. So they do, wear your helmet whenever you're riding a bike or a skateboard. The dangers of texting and driving to the new drivers. Drinking and driving, they'll do that whenever you have that initial education and driver's training. And it's just teaching about all those things that you can do to help make yourself safe. Now, whenever it comes to the enforcement, that's something that, where there's actual laws and legislation involved. And an example of that would be the texting and driving laws that have been popping up here lately. They're designed to help prevent injury from ever happening. And so, if that's going to be part of that prevention, because we raise a law, and you're going to have less people that are going to be breaking that law because they're going to recognize that there's some form of risk behind it. Now, there's also the engineering and the environment. So this is really important, such as you have active interventions and passive interventions. So like passive intervention, that's not going to stop an injury from actually happening. It's just going to protect from an injury without a change in any behaviors. Now, an example would be you're still going to have people that are going to leave medicine bottles laying around, whereas before, they were just simple screw top. Now they have the child protective locks on the bottles where you have to press down or you have to squeeze something, and that's preventing children from actually having those unintentional poisonings or unintentional overdoses on drugs because they don't have the ability to actually open up the drug that they were getting into before. Now, you also have economic incentives. There's periodically, these companies or governments, they'll get grants for buying tourniquets, such as with the Stop the Bleed campaign, or you'll have communities that will give out helmets to all the kids, or have police departments that that'll hand out logs for the firearms, and you have smoking cessation kits or fire extinguishers that you can get at a relatively low cost. So you're doing something that can potentially prevent an injury from ever happening or prevent a disease from ever happening, and there's very little cost involvement on your side. So, and all these are all going to be things that lead to a reduction in certain threats, whether it be poisonings, trauma injuries, things like that. Now, a big thing about us is, as EMS providers, is we actually get direct contact with a lot of people. So we have primary prevention. Primary prevention is the name given to actions that stop injuries or illnesses from ever even happening before they even begin. And a good example of that's actually going to be vaccinations. So smallpox, polio, things like that. We don't come across people on a day-to-day basis who have smallpox or polio or pertussis because of vaccinations. They prevent those diseases from ever even occurring. Now, you also have secondary prevention. It's not going to be something that prevents the injury from ever actually happening. It just prevents the injury from getting any worse than it could have been. This is going to be an example of guardrails and helmets and even EpiPens and seatbelts. So those are all things that they don't necessarily prevent the injury from ever happening. They don't prevent the bee sting from happening, but what they do prevent is with the use of the EpiPen, they prevent it from being as bad as it potentially could have while we wait for EMS and get that patient to the hospital. Those are the real big things about public health. So it's we do have a role in making sure that the public is knowledgeable and well informed about things that they can do to protect themselves and protect those that they care about. There is a time and a place for everything, so teachable moments are not those whenever somebody's actually seriously injured or sick. But whenever there is a time and place, and it's that golden opportunity for you to help change somebody's life for the better. And those are the real big things that we need to be worried about with public health.